Hey ho, let's go. My name is Dr. MarkAlain Dery. I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live here in New Orleans, Louisiana, and I serve as co-chair for the ACOI. Hello, ACOI. Infectious Diseases Subspecialty Section. As providers, we have drastically seen how the realm of public health has influenced our professional lives, whether we serve in academia, in administration, in research, in private practice, or within the hospital setting, or all the above. Oof. COVID has become synonymous with the term public health recently and has dominated our dialogue over the last year and a half. And rightly so. But we know that there's a lot of other issues that deserve attention too. So you best know the ACOI for providing a variety of quality CME for physicians, both online and in person, and more than providing internal medicine CME, the ACOI has been working diligently to keep you up to date by sharing updates on the ongoing COVID-19 saga, as well as expanding our coverage to include other public health concerns as well. So coming up next month is the ACOI Annual Convention and Scientific Sessions. So make sure you join us in person in Orlando from October 27th to the 30th. This guy right here is going to be there. And if you can't make it in person, you could be there virtually. So we hope to see you. So let's get started. All right. Time for some very some somber stories here because September is Suicide Prevention Awareness Month. And I thought that we should talk about that for a little while. And so here we go. Now, prior to COVID-19 pandemic, the U.S. was already facing a mental health crisis. A recent Johns Hopkins guide to suicide risks in the pandemic notes that the annual suicide rate in the U.S. has steadily increased over the past 2 decades. In fact, in 2019, it was 14.5 per 100,000. That's up from 10.4 per 100,000 in 2000. So that's quite a huge increase in about 19 years. Now, according to the CDC, from 2016 to 2017, the suicide rate rose by 2% each year. That means that there's been a 26% surge since 1999. Now, in 2019, nearly 50,000 Americans died by suicide in over 1.3 million attempts. This is hard for me to read. All right. It is the 10th leading cause of death in the U.S. and the second leading cause of death in males under the age of 44. And now today we can say assuredly that the pandemic, especially as it lingers on, is exacerbating this public health crisis because interestingly, Johns Hopkins guide also points out that the previous pandemics, including the flu pandemic in 1918, the SARS outbreak of 2003, and the Ebola epidemic have all been associated with increased suicide rates. Yet suicide is a bigger problem and it can't be blamed solely on the pandemic, although isolation and fear has created and has made it a major contributing factor. But rather, we need to consider and we need to think about things that we refer to now as deaths of despair. Suicide is part of a bigger problem that includes alcohol-related deaths and drug overdoses, and these deaths of despair are being considered an epidemic within the pandemic. Now, it is a perfect storm of sorts with several risk factors at play, including economic stressors, seemingly inescapable anxiety, social isolation, pandemic-related barriers to treatment, alcohol and drug abuse, and mixed within it all are increased gun sales because we are a country awash in guns. In fact, I think we have one gun per person in this country, and we are a country of 330 million people. So the last point is important since guns are the most common means of suicide in the U.S. And interestingly, the Harvard School of Public Health suggests that there is a link between suicide rates and the prevalence of gun ownership. And this is something we need to explore for a future video blog. Interestingly, there's a gender split in suicide rates between men and women. In comparison with women, men in the U.S. are 4 times more likely to commit suicide. It's almost 35,000 men die by suicide annually in our country. And breaking that down, A man commits suicide once almost every 15 minutes. And in 2019, nearly 70% of all suicide deaths were white males. And when a man commits suicide, they tend to use more violent methods in their attempts. Thus, unlike women, the chances of successful interventions are almost zero. And by the way, men account for the majority of gun owners in this country. So there's no two ways about it. Suicide is a public health threat, and it is a true epidemic. So what can we do as osteopathic physicians to recognize the risk of suicide in our patients? What we do know is that asking high-risk patients, specifically individuals who've had previous suicide attempts, about suicidal intent actually leads to better outcomes and does not increase the risk of suicide. So let's ask about it during our interviews. As we encounter our patients, things to consider in the history, our intent, our plan, and means. What is the availability of social support? Was there previous attempts? And the presence of comorbid psychiatric illnesses or substance misuse. Now, as physicians, we should do what we can to activate support networks and initiate therapy for psychiatric diseases for at-risk individuals. Being alert to at-risk patients is part of principle-centered medicine and treating the whole patient. Yet as importantly is how we respond when we see a colleague in distress or showing suicidal ideations, and this leads me to addressing another epidemic, that of physician suicide. Last week was National Physician Suicide Awareness Day, and we can't let this go by without noting that too many physicians are depressed, they're burned out, and they're exhausted. In fact, it has been known for more than 150 years that physicians have an increased propensity to die by suicide. Back in 1977, it was estimated that on average, the U.S. lost the equivalent of at least one small medical school or a large medical school class to suicide. It's actually hard to have exact numbers due to inaccurate cause of death reporting and coding, but it is thought that approximately 300 to 400 physicians per year, or perhaps that's a doctor a day, dies by suicide. And of all occupations and professions, the medical profession consistently is near the top of occupations with the highest risk of death by suicide. And last year, many of you might remember the passing of an ER physician from New York. Her name was Dr. Lorna Breen, and she died by suicide. She had contracted COVID-19 and she recovered. She went back to work to face what she described to her family as devastating scenes of the toll the virus took on her patients. And to manage the onslaught of COVID patients, she worked multiple 12-hour shifts in a row and stayed late every day. How many of us can relate to that? She was truly in the thick of it all early in the New York epidemic, especially as ambulances regularly delivered COVID-19 patients to her hospital. And her family reported that she never slept, and when they spoke to her on the phone, they could hear the deepening distress in her voice. So, like many, she was caught in the stigma that exists, that physicians are superhuman, and we cannot show weakness. I applaud Dr. Breen's family for standing up to make their daughter's plight public. So they set up the Lauren Breen's Hero Fund to provide mental health support to healthcare professionals. And additionally, due to their efforts, the U.S. Senate last month unanimously passed the Dr. Lorna Breen Healthcare Provider Protection Act to help grant funding for suicide prevention and peer support for mental health care programs at healthcare facilities. In a recent podcast from the ACOI that I encourage all of you to listen to, please listen to Dr. Julie Sturbank as she shares what we can do as colleagues to help one another prioritize our own self-care. She speaks from a place of knowing. She lost a colleague early in her career to suicide. So I encourage my colleagues to find ways to take time off. And when we know that we need a break and we need to get professional help, if you need to, there is no shame in reaching out for help. We need to be there for one another. And so, in conclusion, I just want to say, please stay on the lookout for more of these updates. And to read more from the sources used in this report, please go to the acoi.org mac.com/resources. Together with the ACOI, we'll help you have the latest information to help you respond to patients. Please feel free to reach out to me anytime at madery@mac.com. Please stay safe, and as always, thank you, Gina, for a brilliant script.